The why behind my strategic plan is the result of the number one complaint from patients who visit the ED, and that is prolonged wait times in the emergency department waiting room prior to being seen. As wait times go up from 0 to 5 minutes to more than 30 minutes, patient satisfaction scores drop from 95% to 80%. This translates into the following patient dissatisfiers that identify three key problems. First, patient dissatisfaction is something that healthcare organizations cannot afford these days more than ever. The Centers for Medicare and Medicaid Services have identified patient satisfaction as a key marker of value, and these statistics are available on hospital compare websites. There is also a strong correlation between patient satisfaction in the emergency department and HCAHPS scores, which are publicly reported survey results also posted on hospital compare websites. Because the emergency department is known as the front door to the hospital, the emergency physicians and hospital administrators take patient satisfaction scores in the emergency department very seriously. As wait times increase, patient satisfaction decreases, and this is significant because reimbursement is tied to HCAHPS scores. Therefore, those emergency departments who ignore wait times can expect a dramatic reduction in reimbursement. Second, left without treatment patients. The American College of Emergency Physicians estimate for every one patient that leaves without treatment, there are 9 other patients who either never came because of extended wait times in the emergency department, or who came and saw a long wait and went somewhere else. Therefore, long waits can result in an emergency department losing as much as 10% of patient volume, which translates into hundreds of thousands of dollars a year. And third, when a patient's primary physician or a physician at a community clinic, for example, tells the patient to go to the emergency department, that is a referral. If the referral is not handled well, which includes long wait times, that will have a negative effect on the referring physician's office and hence a negative atmosphere stemming from prolonged ED wait times. Therefore, to increase patient satisfaction, my plan is to decrease the overall time patients spend in the ED from the time of arrival until the time of their disposition, whether it be discharge, transfer to a higher level of care, or admission to the hospital. The identified opportunities for improvement drive the how I plan to accomplish my task. The 4 identified opportunities for improvement are to improve triage, collaborate with physicians, maintain a charge nurse out of staff, and to improve the lab process. To improve the triage process, our nurse educator recently held a triage class for our emergency department nurses. She provided education with regards to ordering tests that are identified during the triage process, and to facilitate when and what order patients should be seen, as well as sorting patients into the correct ESI category, also identified during the triage process. It's also especially important for the nurses to collaborate with the physicians in determining when to see a higher quantity of lower acuity patients versus higher acuity patients that will demand more time, backing up the patient wait time even more. This vital education empowers the triage nurse to effectively triage the patients, get appropriate tests ordered, and get the patients out of the waiting room and into the exam rooms as quickly as possible. With regards to collaboration, recently the emergency department leaders, the educators, and the IT department met to discuss and review all of the emergency department order sets and to make changes to increase efficiency and save time without sacrificing important diagnostic tests. When completed, the director of the emergency medicine and the IT physician leader met to review the changes as well as make any additional changes. This collaboration between the nursing department and the physicians will produce a more streamlined ordering process for the ED nurses. Additionally, unnecessary tests were eliminated and meds that were no longer ordered were stricken. This also allows for nurses to read through streamlined order sets more quickly and again order appropriately. It eliminates wastefulness of time and resources and thus potentially saves the patient money. The decision to keep the emergency department charge nurse out of staff will also facilitate a more efficient door-to-disposition time for the emergency department patients. The charge nurse, without his or her own patient load, can assist with arranging transportation, such as EMS or air ambulance, to a higher level of care facility. He or she can also assist with requesting a bed for patients to be admitted, or he or she can provide discharge teaching to those patients being discharged. The charge nurse will also be available to assist with giving meds, starting IVs, resolving conflicts, or assisting with room turnover to facilitate patients being moved out of the ED faster and bringing back patients from the waiting room more quickly. Finally, we will be implementing a new lab process that will also improve patient safety, but also eliminate steps for the nurses in the emergency department. This again will lend to shaving minutes off of the stay. To measure the success of this plan, our administrative assistant will run a daily emergency department report, which provides the metrics that measure the following: arrival to triage time, which we have set our goal for this to be 30 minutes or less, arrival to bedtime, arrival to MD assignment time, arrival to MD exam start time, the decision to discharge the patient until the time the patient actually departs the emergency department time, and the MD assigned time to disposition time. We have collected data the previous 6 months, and once all 4 of our opportunities for improvement are in place, we will again collect data for the next 6 months. This data will enable us to see where we have saved time and areas that we need to continue working on. The lab process will also allow the specimens collected and the orders placed to be time-stamped so we can measure these time-saving metrics as well. In addition to this objective and measurable data, we will collect subjective data. Our charge nurses and staff nurses will be asked their perspective on the patient flow, the charting flow, and the physician flow, as their input is as valuable as the objective metrics. We will also continue to monitor our patient satisfaction survey results and HCAHPS scores, as these too are indicative with regards to our strategy to tackle the #1 complaint for patients visiting the ED, which is prolonged wait times. And it is our plan to decrease this door-to-disposition time. Thank you.